Hey, I'm Dr. Joe Feuerstein. Thanks for tuning in. Today, another question that was submitted. It's on the types of labs you might do if you saw an integrative or functional medicine doctor. So I've seen 45,000 patients. Let me tell you some of the labs I might be interested in. So metabolic labs. I'm not just interested in blood glucose and glycated hemoglobin. I'm also interested in your fasting insulin, because that's actually a very useful marker as to where we are in terms of our progression towards blood sugar issues or even diabetes. When we talk about cardiovascular disease, there are lab tests that we do, which are called advanced cardiac testing. There's a few of them. There's a thing called Lp(a), which is almost like a genetic risk of heart disease. We have ApoLipoprotein B, which is your particle number, the number of bad cholesterol particles that you have. We have high sensitivity CRP, which is your inflammation in your blood vessels. Heart disease is not just about cholesterol, about blood pressure. It's also about inflammation. And there's another one called homocysteine, which is an independent, it's to do with the metabolism of B cells and detoxification, but it is an independent risk factor for heart disease. For mood and anxiety, for depression, again, homocysteine would be useful because the B vitamins are important in the production of neurotransmitters like serotonin and noradrenaline. B vitamins themselves might be important. And then if you're looking at things like ADHD, you might be looking at zinc, you might be looking at ferritin. So there's a fair amount. Now into the world of integrative, more functional. So the first thing is that if you have any disease where your microbiome might be contributing, and that could be IBS, and that could be an autoimmune disease, and that could be an allergic disease like asthma or eczema or hay fever, then I'm going to be interested in a full microbiome picture to look at your microbiome. That's a stool test. If I'm looking at hormones, especially if you are on hormone replacement therapy or you're perimenopausal, I might be looking at dried urine, which is called a Dutch test. If I'm looking at adrenal function, I might be looking at salivary cortisol. And then there's other types of tests that we might be doing. Sometimes we check heavy metals, sometimes we'll check organic acids, amino acids, all dependent on what is needed. Just one final thing, it's fascinating that a couple of 100 years ago, the way doctors diagnosed things was looking at the stool and looking at the urine, and back to the way we used to be. Now we're looking at the stool and looking at the urine and looking at the saliva again, but we're using 21st century techniques. So we're analyzing it and looking and growing things, but it's all still back to your body products. Anyway, feel free to send questions. Thanks for tuning in. YouTube, Facebook, LinkedIn. Dr. Joe Feuerstein, thanks.